discussion paper, Regional Health Authority for Governance. The discussion paper has been broken into 3 separate issues as follows: Regional Health Authority boundaries, Regional Health electoral boundaries, and election rules. Although I will speak on each of these issues, I will be providing most of my commentary on the first issue, Regional Health Authority boundaries. In 2008, the provincial government redefined the legislation governing health care into 2 separate authorities, providing services in both the Anglophone and Francophone communities throughout the province. The province, through these public consultations, is now considering a shift in some of the boundaries to include or exclude community based on linguistic preferences. Specifically, the Francophone communities presently being served by District 7 would no longer be served by Horizon Health Authority and would be served by the Vitality in the future. For the Miramichi Regional Hospital, this could have a significant impact as the Francophone communities of Nigawak, Bay-Saint-Anne, and Rogersville would no longer be serviced by our hospital and the Horizon Authority. This is potentially disastrous, as the catchment area for our hospital presently services in excess of 50,000 taxpayers. Should the boundaries be altered, the 3 Francophone communities mentioned above would be redirected to Vitality Authority. This would have a significant impact not only on the annual operating budget of our hospital, but would no doubt lead to significant direct and indirect job losses and redeployment of positions to other areas. This is a time when the economy of Miramichi is struggling to survive. The city has been hard hit by the dissemination of the forest industry and has actually seen negative growth in our tax base and employment numbers over the past 3 years. The province cannot lose sight of the importance of health care to our community. The delivery of health care consistently ranks as a top priority to taxpayers throughout the province and the country. In 2009, a survey taken across the country counted 86.2% of the respondents either supporting or strongly supporting the continuing investment in our public health system. Not only is healthcare an important issue to individuals, but it also has an important role in economic development. Any downgrading to the important services being delivered by our hospitals may have dramatic impacts on our ability to secure additional investments to our city. Investors looking to relocate to a community will include healthcare as an important tool in their decision making. An inadequate healthcare facility will make the potential for increased assessment through additional investment extremely difficult. Given the job losses associated with the closure of the mills and the resulting impact on our economy, any further erosion of our employment base will continue to have a detrimental impact on our ability to offer services to our residents. Recently, Health Minister Dubé released a memo to Horizon employees in Miramichi, indicated there would be no layoffs. This was confirmed by Don Peters, CEO of Horizon Health Authority, when he presented to Council on April the 29th, 2011. Although this is comforting to employees working in our hospital, along with the comments suggesting that with an annual outflow of employees ranging from 800 to 1,000 employees, attrition will take care of any redundancies. There is no guarantee that any redeployment will take place in Miramichi Hospital. It is difficult to comprehend how the potential of as much as 1/3 of our patients may be directed will not have an impact on the employment numbers locally. If the Health Minister and CEO are correct in their assertions that there will be no job losses, can they guarantee the job will remain in Miramichi? A job guarantee in Bathurst or Moncton is certainly more comforting than a layoff notice, but may not be an attractive alternative to workers and his and her family. The family structure in Miramichi has already been impacted by a number of our citizens that have had to move out of the province to allow them to continue to support their families in the Miramichi. Recently, the mayors of the affected communities had 2 separate sessions to discuss the potential changes being suggested for the boundaries. On August 30th, the mayors of the Francophone communities met and expressed their desires to maintain the boundaries as they presently exist. The mayors of Rogersville and Niguac positively described the exemplary services they presently receive from the Miramichi Hospital, and that these services has always been delivered in a manner that respects the linguistic preferences of the patient. It was also clearly stated that the additional transportation involved in driving to either Bathurst or Moncton was something that their residents was not interested in. A similar session was held with the Anglophone communities on September the 1st with a very similar message delivered. Mrs. Minister, do not change our boundaries. It is also important to note that patients in these communities have relationships that have been built up with their present healthcare providers. The reality is that this relationship is extremely important, and as people become comfortable with a physician or a nurse, it becomes difficult to move from that service provider. Local physicians will continue to serve these patients, and patients will continue to want to be served by the local provider, which really makes this discussion redundant. The unfortunate reality, however, is that with a redefinition of the boundaries comes a change of the respective budget of the respective health authority, meaning the local authority will be providing consistent levels of services with reduced funding, and the Vitality Authority will be providing similar services as they presently provide with additional resources. In a memo released to Horizon employees, the Health Minister speaks to the fiscal challenges facing the province. Minister Dubé indicates that cost-cutting measures needs to be addressed by both authorities to allow the province to attempt to begin the budget balancing process. Shouldn't part of this process include reviewing the duplication of similar administration services in both authorities to try to maintain the level of health services presently existing and required by taxpayers? My final comments on this issue will be based on the quote made by Dr. Rosier. We offer high quality of care, and yet they're seen fixated on the relocation of boundaries, so it will be advantage to vitality. That was his quote. Healthcare is extremely important to the taxpayers of this province. And although we need to respect the requirements of all citizens of this province, funding allocation should be based on need and not on linguistic preferences. Now, the second issue of discussion paper relates to electrical boundaries. And the discussion paper refers to three principles being equality, representation, and transparency. Equality refers to equal representation based on population. Representatives refers to boundaries defined by the interests of communities. Geography and other administrative boundaries, and transparency refers to openness to the public. Although these principles are supported by the municipalities, it does not seem to be a standard that presently applies. Recently, 2 local members were dismissed from the board without a detailed explanation having been provided. This would suggest that the principles of equality, representative, and transparency are not being adhered to. Without a doubt, this issue is one that galvanizes this community like no other. The basic premise of providing quality health care is one that is held dear to the hearts of Miramichiers. Any suggestions of change to the existing system might diminish the quality of life in the region is going to generate the level of civic demonstration like no other issue. This was demonstrated a number of years ago and will not be taken lightly if these proposed changes are enacted. We are proud of our hospital and the people who work there and will not tolerate any changes that will further change the face of our fine city and our region. Thank you.